The point that is important when we talk about low and middle income countries are compared to the so-called developed countries is of two issues. A majority of cancer patients today are in the lower and middle income countries. Majority deaths are also in the low and middle income countries. But when we're looking at the resource distribution, 90% of resource is in that area where there's only 30% patients and lower than 20% death rates. If you're looking in terms of research publications, then again it's from that particular area. So the biggest disparity is that we don't have data coming in because we don't have proper cancer registries. So one of the major needs in low and middle income countries is to have a good cancer registry, to develop the registry. Second issue is that I have a strong feeling is that people are not literate enough. I'm not talking educated or having a degree. I'm talking in terms of health literacy. There is not enough health literacy or advocacy leading to health literacy. So awareness is lacking. And since awareness is lacking, there's a lot of fear. And since there's a lot of fear, there is nothing like screening that is possible. And second part of it is that if you're looking at the healthcare structures and the LMICs the LMICs basically do not have fundings that come from the government or for the insurance. Majority of them are out-of-pocket expenditures. So if I look at it carefully, out of every 10 patients who go in for cancer treatment, there's a chance of 4 of them going into a pecuniary hardship, and you might land up with at least 3 of them going into bankruptcy. So that needs to be taken care of very carefully. The other major issue that's coming up in the low and middle income country when we're looking at it is that we are not adapting the methods of treatment and guidelines in the right framework into a developing country. So we need to see that we understand the issues that are important. For example, in the developed countries, infection as a cause of cancer accounts for less than 10%. But infection as a cause of cancer accounts for almost 30% of all cancers that we see in developing LMICs. Things like, say, hepatoma, that's related to two viruses, hepatitis C and hepatitis B. Cervical cancer, which is related to basically an HPV virus, or a nasopharyngeal carcinoma related to an EBV virus, or say some stomach cancer related to Helicobacter pylori. So when these are related, these are methods of prevention are there which can be handled. Now this is another aspect that we are not paying too much of attention on. So we need to keep in mind that the diseases are different, the disease methodology is different, so approaches have to be different. The other thing is that we have to learn that when we talk of LMICs and healthcare services, that it's just not strengthen the governmental methodology, but also to strengthen the non-governmental agency. To give you an idea of how cancer care is done in LMICs is 30% of patients actually go to a structured institute where cancer care is done in these countries. 70% don't reach these centers. So when we make a guideline, we make a system, it is to this 70% that we have to cater for. Then comes up a major issue, and that issue is palliative and supportive care in developing countries. We very often talk about it, but we don't pay too much attention to it. For example, again, that in developing countries or LMICs, we have 75 patients who come with advanced cancers. These patients are actually not going to get cured. I know that there have been breakthrough methods in our treatment methodologies, that they have gone into cutting-edge research with immunotherapies and liquid biopsies to diagnose and targeted therapy. But effectively, in countries where they are affordable also, they are actually applicable and have fruitful results in about 15%. In a developing country like LMIC, this doesn't even happen because the affordability is not even there for those 15%. So we got to think of good palliative care and early integration of palliative care in treatment. So we need good guidelines for good supportive and palliative care in this. So till the time we are reaching out and getting these things organized, I think the best method of approaching anything in LMIC is to look at prevention. This prevention of cancer has to be something that has to be inbuilt with ongoing programs. These ongoing programs are something which are there already within the health structure. So if we can integrate them, it becomes important. Like we have the sustainable goals for healthcare, which WHO has laid down, if we can get into these chronic disorder groups, and in these disorder groups, we can start integrating concepts of methodology of preventing cancer. Say, for example, if you start thinking of HPV vaccination, HCV treatments and early detection, HPV vaccination, they all get integrated with, getting treated with basic disorders or childhood immunization schedules. The other is trying to change lifestyles, because unfortunately the LMICs are also at what is called a phase of transition. They're moving away from infectious disease to communicable disease, but in the process they have both the disease running in the society. So this is a zone of transition. They are moving away from societies of have-nots to a society earning. So they're picking up side effects and bad habits which can lead into disease for the advanced countries. So they have dual burdens. So till the time we have to learn, till we get good methodology, the finances come up and we have cost-effective treatments coming up and cost efficiency ratios done, we'll have to think of how do we handle the issue of this preventive care within our means. For example, taking care of our diets, taking care of exercises, taking care of the vaccines that can be provided, and trying to lead a healthy lifestyle. So for right now is, let's do something is have a health policy, but let's not play health politics. And by that I mean that, you can't have fly-by-night people coming to LMICs and saying we're going to take care of your burden. You have to have health governance, and it has to be a global governance that's got to be important.